Tardive dyskinesia, often called TD, is a neurological condition that causes involuntary, repetitive movements, most commonly in the face and mouth. These movements can include things like grimacing, tongue movements, lip smacking, or rapid blinking. For many people, these symptoms can be subtle at first, but over time, they may become more noticeable and even interfere with daily life. TD doesn't just affect the face. It can also cause involuntary movements in the arms, hands, legs, or feet. These movements are often rhythmic and repetitive, and they can make everyday tasks more challenging. Tardive dyskinesia is most often a side effect of certain prescription medications, especially those used to treat mental health conditions like schizophrenia, bipolar disorder, or severe depression. These medications are known as antipsychotics. They are prescribed to help manage symptoms of mental illness, but they can sometimes have unintended effects on the body's movement system. Antipsychotics work by blocking the action of dopamine, a key chemical messenger in the brain. Dopamine plays a major role in how our muscles move and how our bodies control those movements. When dopamine is blocked, it can disrupt the normal balance in areas of the brain that control movement, such as the basal ganglia. This disruption can lead to the involuntary movements seen in TD. Taking antipsychotic medications for a long period of time, or at higher doses, can make the brain more sensitive to changes in dopamine levels. This increased sensitivity raises the risk of developing TD. As a result, some people may start to notice unusual movements that they can't control. These symptoms can be distressing and may affect self-esteem and social interactions. The risk of developing TD increases with both the length of time a person takes antipsychotics and the total dose they receive. Regular check-ins with a healthcare provider are important to monitor for symptoms. Anyone who takes antipsychotic medications can develop TD, regardless of age or background, though some people are at higher risk than others. In particular, TD is more common in older adults and in women. Recognizing the signs early and talking to a healthcare professional can help manage symptoms and improve quality of life. TD usually affects the muscles of the face, mouth, and tongue. Common signs include lip smacking, tongue thrusting, and grimacing. A person with TD may also have rapid blinking or puffing of the cheeks. These movements are often repetitive and uncontrollable. Sometimes TD can also affect the arms, legs, and torso. This can cause movements like tapping, writhing, or swaying. These movements can be embarrassing and interfere with daily life. It is important to remember that TD is not the person's fault. It is a medical condition that requires treatment. Imagine you are having dinner with a friend. You notice they are constantly smacking their lips and sticking out their tongue. They seem unaware of these movements. This could be a sign of TD. Another example is an older adult rocking back and forth in their chair. They may also have jerky movements in their arms and legs. These movements are not intentional. They are a symptom of TD. It's important to remember that TD can affect anyone taking antipsychotic medication. Recognizing the signs early on is crucial for managing the condition effectively. If you notice any signs of tardive dyskinesia in yourself or someone else, such as unusual facial movements, repetitive motions, or difficulty controlling certain parts of the body, it's important not to ignore these symptoms. Sometimes the movements can be subtle at first, but over time, they may become more noticeable or even interfere with daily activities. That's why it's really important to talk to a doctor right away if you have any concerns. Reaching out early can make a big difference in how the condition is managed and can help prevent complications down the road. Early detection is key to managing symptoms and, preventing the condition from getting worse. The sooner you seek help, the more options you may have for treatment and support. When you visit your doctor, they will ask about your medical history, including any mental health conditions, and review all the medications you're currently taking. This helps them understand what might be causing the symptoms. They may also perform a physical exam to assess your movements, watching for patterns or triggers that could help with diagnosis. Treatment for tardive dyskinesia usually involves adjusting medications. Your doctor might review the benefits and risks of your current prescriptions and discuss possible changes. The doctor might lower the dose of the antipsychotic, switch to a different medication, or recommend stopping a drug if it's safe to do so. Every case is unique, so your treatment plan will be tailored to your needs. There are also medications specifically designed to treat tardive dyskinesia. These medicines work by targeting the abnormal movements and can be very effective for many people. These medications can help reduce the severity of the movements, making it easier to go about your daily life and feel more comfortable in social situations. In addition to medication, lifestyle changes can also help manage tardive dyskinesia. Gentle exercise like walking or stretching can improve overall well-being and help reduce stress. These include getting enough sleep, managing stress through relaxation techniques like meditation or deep breathing, and maintaining a healthy daily routine. It's also important to avoid alcohol and caffeine, as these substances can sometimes make symptoms worse. By working closely with your healthcare team and making healthy choices, you can take positive steps toward managing tardive dyskinesia and improving your quality of life. Tardive dyskinesia can be a challenging condition to live with, affecting not only your physical health, but also your emotional well-being and daily life. The involuntary movements can sometimes make simple tasks more difficult, and it's normal to feel frustrated or overwhelmed at times. However, early detection and timely treatment can really make a big difference in managing symptoms and improving quality of life. The sooner you recognize the signs, the sooner you can work with your healthcare team to find the best approach for you. If you are taking antipsychotic medications, it's important to be aware of the signs and symptoms of tardive dyskinesia, such as repetitive movements of the face, lips, tongue, or other parts of the body. These symptoms can develop gradually, so staying informed and observant is key. Don't hesitate to talk to your doctor right away if you notice any unusual movements or changes in your body. Open communication with your healthcare provider can help ensure you get the support and care you need as soon as possible. Remember, tardive dyskinesia is not your fault. It's a side effect that can happen to anyone taking certain medications, and you deserve understanding and compassion from those around you. With proper medical care, ongoing support, and a positive outlook, you can manage your symptoms and continue to enjoy meaningful moments with friends and family. Many people with tardive dyskinesia lead active, fulfilling lives. Always consult with a healthcare professional for any health concerns or before making any decisions related to your health or treatment. Your doctor can help guide you through your options and answer any questions you may have. This information is for educational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the guidance of your physician or other qualified health provider with any questions you may have regarding a medical condition.